Have you heard of the term nursing mother's neck? Or perhaps you've heard of the term tech neck? So, nursing mother's neck is like actually the original tech neck, right? So, let's talk a little bit about what that is. So, many times when women come in during their pregnancy, they're usually experiencing more low back or maybe mid back or pelvis challenges. It could be things like low back pain or heartburn or nausea. Usually it's the bulk of the lower part of the spine where they're feeling most of the symptoms. After the baby is born, this pain presentation tends to shift upwards towards the neck and the upper back. So, what happens when we're nursing our babies, or even outside of nursing, when you have a newborn, you're looking down, carrying the newborn, and you don't want to move your position, and so baby's about asleep because you will contort your body, or at least many of my practice members do. I'm sure I myself did as well. We tend to contort our bodies to make it comfortable for the baby, right? And when we're nursing, especially if you're having challenges with nursing, but we'll talk about that in a different video. But when we're nursing, right, if you're looking head down and you're holding the baby, the challenge is that we can be in that position for 15 to 20 minutes at a time. And depending on how often you're nursing your baby, it can add up, right? Because you might go from that position to maybe taking care of laundry or food prep or dishes or maybe even sleeping, and then you kind of sleep in this curled up position. But what happens is that because of muscle memory, it tends to kick in after about 45 to 90 minutes of repetitive muscle actions. Then we tend to start to develop those muscle memory patterns. And so everything starts to get hunched up and kind of crunched up in front of us. And so our head is now supported by the muscles in our neck and our upper back, as opposed to the spine being able to support that. So our spines are actually created or developed in a very ingenious way because, as you can see in the spine here, the middle section of the spine, the thoracic or mid back section, is kind of like a C curvature. And then the neck and low back, the opposing ends of the spine, are doing the opposite curvature, right? So it kind of creates this really nice balance throughout the whole spine. But that's if you're using your structure correctly. If your head is now coming in front of your body, you're engaging the muscles to support your head. And our head, if you saw, Jerry Maguire, an adult head weighs this average weight of a bowling ball, which can be 8 to more than 10 pounds. And so if the muscles, which are designed for support, not stability, of our head are now engaged for longer durations of time, we start to fatigue those muscles much more quickly, right? And so when we're in this position, our muscles are activated both on the back of our neck as well as the front of our neck to keep our head up. So if you kind of imagine a bowling ball hanging off the edge of a cliff and you're holding onto these ropes, it's kind of like those muscles are like those ropes. Not really, that's an exaggeration, of course, but it's kind of like that, where we've taken away the ability to support our head, the weight of our head with our spine. And now we're utilizing our muscles to do that all day, every day. So there are some great stretches that you can try that are in the YouTube channel here. But one thing to try to pay attention to is that after you've nursed or after you've carried your baby, to try to do a stretch or an exercise that will help open up the front of our bodies and will allow our head to come back and sit on top of our shoulders. So you can try to think of keeping your ear stacked above your shoulder, which would then be stacked above your elbow and your hip to maintain a neutral posture. But even if you don't get a chance to do that, or the baby just fell asleep and you just have a couple minutes, if you can take 30 seconds and do a stretch to help allow some better oxygenation and some better blood flow, you'll feel great. And if you'd like to check out more stretches or more ideas about how to improve the health of your body, if you'd like to delve in deeper to figure out what is happening for your body, your health, and what you can do to help improve that, please check out the course, Move Well, Eat Well, Live Well. There's more details below, and I'll see you next time.